Let's now see how we can expand this model with other hypotheses. We can, for example, add a prior to exposure based on job category and say that you have 3 job categories: home, office, or frontline worker, and that this impacts your exposure to the virus, so you can create a link between job category and exposed. Now you see that the exposed node was updated, and you can update the marginal probabilities based on home, office, or frontline. We can also have a posterior node on the severity, and we'll now have a different type of node called a discrete node that will follow a discrete distribution. A simple binomial in the case of not getting the virus, or a Poisson law with 4 possible outcomes in the case where you catch the virus and the level of severity goes from 0 for not being exposed to 4 for death. We can now set the got COVID node to true and sample. And we'll see how the severities go from 1 to 4, with 1 being the most probable, obviously, and 4 the least probable. And if we set the got COVID node to false, as we saw, the only severity that we should get is 0, which is the lowest level of severity, or not being infected. We can add a prior link between job category and being vaccinated or not in order to guide the policymaker on who should get vaccinated and what their priority should be. If we arrange the node and add a note for risk factor based on comorbidities, we'll see that in this case we have a discrete node as well with 3 possible outcomes. We limit the number of risk factors to 3, and we have a Poisson law the same way as before. And we can add, for the sake of it, age in 3 categories: low, medium, and high. And we'll see that age impacts your job category, obviously the fact that you're vaccinated, but also the amount of people that you can infect. You now have a contagion node, which is of a different nature. This node is a mixture of continuous distribution, and that's why it's represented with a dashed circle. Based on whether you're infected or not, it will call upon different distribution laws. If you're not infected, obviously you're not contagious, and if you're infected, you can be contagious at different levels depending on your job category or your age. Based on this contagion and severity number, we can compute a cost for health insurers, which ranges from $0 to $50,000 based on numbers that we have collected over various reports. We now can test different scenarios of vaccination. If we have limited vaccines, say enough for 1/3 of the population, and vaccinate everybody with equal probability, what will be the various distribution of COVID numbers, contagion, severity, and eventually cost? We'll obviously make assumptions. Some of them have been picked based on data collected over the internet. Others are simple guesses. You can start a model with very basic information and refine it. In this instance, the most likely costs range between $30,000 and $40,000. We can save the values of this sample for further analysis, as we will see later. A CSV file is generated with all samples, 10,000 rows, and 1 column per node where names appear on the top. We can now test a different policy of vaccination, one where we would only vaccinate senior people, so people falling in the high age category. If we did this and vaccinated no one but the seniors, as you see on the table on the right, only the high age group are vaccinated, we can resample and save that value for further analysis. We now are interested in a different policy where we vaccinate mostly people who are going to be exposed, frontline workers and people in the mid-age category who are going to work in the office, and we do not vaccinate people who are more likely to stay at home. We run a sample again and save those results for further analysis. Once computed, we represent the distributions of the cost node along with key metrics for the various scenarios that we have computed. On the top left in blue is our baseline case, or people randomly selected for vaccination. We see that leads to an average healthcare cost of about $46,000. On the top right in orange is the case where we vaccinate seniors as a priority, and according to our model, it leads to a very similar outcome as the first scenario in terms of healthcare costs. On the bottom left in green is the cost distribution for the scenario where we vaccinate people who are the most exposed. It displays a significant drop in healthcare costs down to $37,000, so about $10,000 less. For better comparison of the risk profiles, we show on the bottom right the comparison of the cumulative distribution function. Thanks for watching. For more information, contact us at info@tenoconda.com.